So let me I just want to introduce my computer system, which crashed today. So I'm on a backup system, hence no video. I apologize for that. At any rate, it's my pleasure to introduce Jessa Barnard, but I would like to give you a little bit of context. So Jessa, so you'll know, just yesterday we had on Monday we had a talk on physician employment, and it's steady growth over the last 30 to 40 years. And from Dr. Kevin Schulman and UCSF, and also he introduced the idea of unionization as one response to problematic work situations, or even non-problematic ones. And yesterday we had several doctors who are in labor unions discuss that. So I thought it would be useful for our group to also understand the different role that medical societies can have and the extent to which there could be overlap with what physician labor unions might do, and also make a case for what the value that medical societies can have to both medical students and grads. And I want to say Jessa Barnard is Vermont Medical Society's executive director, and she's a Vermonter, but got her bachelor's from Dartmouth and her law degree out at Stanford. She was Vermont Medical Society policy specialist from 2002 to 5, and she worked for several years in the Maine Medical Association as Associate General Counsel, and dealt with a lot of legal and regulatory concerns. And she came back to Vermont in 2016 and was initially General Counsel and Vice President for Policy, but now has in 2017, and since 2017, has served as the Executive Director of Vermont Medical Societies, Vermont Medical Society, sorry. And quite pleased to have Jessa here. She's a real expert on policy and on the process for helping physician ideas to have a favorable hearing in the legislature, and also to help educate the society in terms of ongoing new policy issues. So I'm thrilled to have Jessa Barnard here. Thank you so much for coming.
Sure. Thank you for having me. And, it's interesting to think about medical societies and unions close together because they're, I think, getting more and more merged. In fact, some states are state medical societies are partnering with unions and in conversations with them about how to work together. Certainly a lot of common reasons to work with physicians and ways to advocate to improve the climate for practicing medicine. So I won't be talking about unions, but the flip, the partnership of how to work with a medical society to get change for the climate in which you practice, for your patients, for advocacy issues you care about. And then I'm going to give a lot of Vermont examples because that's where I am now. That's where I work now. But I worked, as Marvin said, for the Maine Medical Association and work closely with a lot of other state medical societies. So these are more illustrative examples of how state medical societies work and how, as a student or practicing physician, you can get involved with either a state or national medical society or medical association. Same thing, different name for this. Different medical societies go with different names, either society, association. So I will jump in. Feel free to interrupt with questions, raise your hand, chat them in. I'm happy to have a discussion. And I also assume there will be some time at the end. I should not take all that long. But I did want to just first give you some examples of medical societies and make sure everybody knows that whichever state you live in, and it's great to sort of hear where you are, you're all across the country, there is a state medical society. All 50 states have one. They generally focus on legislative and regulatory advocacy for their state's medical community And I'll show you some of this further on. I'll do a lot of other sort of educational events and networking and other purposes as well. But for especially state legislative and regulatory change, that would be my first place to go. Then there are also the specialty medical societies. So based on the area of practice, and they get pretty subspecialized, but there are, the American Academy of Pediatrics, the College of Radiology, the American Psychiatric Association, so many national specialties. They also have some state chapters, so it gets sort of doubly confusing. Those are national organizations with state chapters. The state medical societies for all specialties are not chapters of a national organization. So we are not chapters of the American Medical Association, for example. We are standalone, just state-based organizations. And then you also have your national medical societies for all specialties. So the AMA, the American Osteopathic Association, and others. So those are the breakdowns. Almost all of these, are probably all of them, I just don't know 100%, have student membership, whether it's free or very low cost. So if you have any interest, I would encourage you to join as many as you are interested in, just to learn about the work they do, what you can take advantage of as a student, the trainings, whether it's more clinical content and conferences or advocacy and policy oriented. Just dive in and learn, even just get on their mailing lists to sort of learn about what's available. And whether it's, again, at the state or national level or both, I would sort of encourage you to test the waters widely. So again, using this is an example of what a state medical society looks like. This is what our membership looks like in Vermont. We have both individual members and then group memberships with larger facilities. We don't represent facilities, though. We are the membership organization for individual physicians. We also now have PAs as members, and then students and residents. So even when we have group memberships, so say one of the academic medical center in Vermont helps support all of their employed physicians being our members, we never talk about ourselves as representing the hospital. We represent the physicians who work there. And so that's where you get into a medical society is addressing issues about workplace conditions and administrative burden and things like that. A little different than unions. We don't, negotiate. We wouldn't say negotiate directly with an employer in most instances. We would be more working on, say, policy levers and policy level changes, whether that's regulatory, rules from an administrative agency or legislation around those sorts of topics. So I'm on the staff side. Obviously, you heard I'm an attorney by training. So we are a very small medical society staff-wise compared to, others around the state. We only have 4 full-time staff. And also most medical societies have, at least that number of staff, if not much, much bigger. But we are not practicing clinicians for the most part. But our membership and our leadership, our board, is made up of physicians. So we have an executive committee, our board that sets our policies and our direction, and then we include student and resident representatives on our board. And again, I think most medical societies do that. Many medical societies, especially those that are a little bigger than we are, have actually student sections or student groups. So you can even engage directly just with students before then bringing, say, topics to the full medical society board. Because we're smaller, we have a little more direct access. Students participate directly on our board. And the kinds of things students can do with a medical society, get our newsletters. We try to make it very translate into quick action what's happening at places like the State House in Vermont, the legislature. So we will, we have advocacy staff who follow what bills are happening, when hearings might be taking place, when you might want to write the governor on an issue, and we get that out in our newsletter in a timely way and give you easy ways to submit comments or make phone calls. The way we set our policies in Vermont, and this is a little different, medical society by medical society, is through our board. But most medical societies have, whether it's through their board or a membership meeting, a resolution process where members bring kind of written topics forward as a resolution to, again, either the board or membership for action. And if that's adopted, that drives the policy, that becomes the policy of the organization. So if you have a topic you're really passionate about in your state or specialty, and you don't think that an organization you're active with is engaged enough or paying attention to it or knows about it, and you want to bring an issue to their attention, a great way to do that is through a resolution. Again, and I'll talk a little bit more about some of the national societies, but they also have resolution writing processes and have a student section that brings resolutions to at the national level. So that's a great way, if there's a topic you're interested in, to kind of dive more into it and get it some attention and get action. I mentioned we have student representatives on our board. We have students attend most of our events for free. So I think that's, again, pretty similar in other state medical societies. And again, as with other medical societies, while legislative and regulatory action is kind of at our heart, we do other things. And I will talk about, again, to sort of add to the confusion a little bit of the division between state medical societies and specialty medical societies. I will say in Vermont and many other states, we actually provide the administrative support for many of our state chapter specialty societies. So they're their own organizations, they have their own boards, they're their own 501c3s, nonprofits, but they're too small to hire their own staff. Or hire their own lobbyist in Montpelier, in our case. So they contract with the state medical society, with Vermont Medical Society, to help staff them and organize their board meetings, organize their events, their annual meeting, and then for some of them also advocate on their behalf at the legislature. And again, that's similar in many states. Most, I think at this point, 49 states also have practitioner health programs. So I will mention it, even though it's not an advocacy topic, just because I think every student should know that these exist. And ours in Vermont is run by the Medical Society. They assist students and residents and practitioners who have an impaired ability to practice medicine, from substance use disorder, mental health conditions. Some states do even broader topics. Many states have actually bigger programs than ours and work with a lot of licensees, including nurses, pharmacists, others. But then it is basically an evaluation and then a monitoring program, so you can continue to practice safely, whether or not you are involved with your licensing board. So just flagging that, if your state, unless you're in California, California is the one state creating one, or they've had some issues having one officially recognized. All other states have one, and encourage you to reach out on your own behalf or for any peers or colleagues who need assistance. Again, as examples of what medical societies may do, we run a leadership training program for physicians. We run a medical student scholarship program, educational resources on regulatory and legal topics, including a guide to health law here in the state. And then, as I mentioned, if in the advocacy realm, a great idea, a great way to get started is by submitting a policy resolution that drives our advocacy work. It sets our agendas. They can be in Vermont submitted year round, but I'm sure in whichever state you're in, if you look on the website of the State Medical Society, it will tell you how to submit one, what the process is. I think similar to Vermont, the staff of the Medical Society are very happy to help you draft it. You could even just bring an idea or a concept. So say you wanted it to be, physician unionization or resident unionization, you want more of a policy supporting it, or clarifying who can unionize or something like that. You could create that into a resolution form, which is basically the background statement and then the action you want the medical society to take. And and then you could even just bring that idea to the staff, and they would probably help you craft that into something that you could submit, or help you clarify what existing policies the medical society may have, so you're not duplicating or repeating something. We also do a lot of events, as other medical societies do. So we try to make it, I know around the country, try to make it really easy for students and others, practicing clinicians who want to get involved. Events at the Capitol, legislative trainings, Coffee is connecting you to your own local legislator within your state to come to events at the medical school. And then, as I said, by helping with our newsletter, kind of track what's happening and let you know easy actions you could take, like writing an email, making a phone call about bills moving through the legislature. And just to give, again, some examples, while this is in Vermont, it's probably not that different from at least other blue states of the types of issues we're working on. So prior authorization, we had a big bill last year reducing prior authorizations. We've been involved giving feedback on creating an overdose prevention site in our biggest city of Burlington. We're very involved, one of the few organizations, in fact, involved on a public health approach to cannabis regulation, things like limiting advertising and potency limits in our state, which does have both medical and recreational sales. Very engaged on telehealth access and reimbursement issues. Here in Vermont, we have provider shield laws protecting those who perform or seek reproductive services or gender affirming care. So this most recent session, we tightened up some of those protections. Mental health issues, gun safety issues, violence in the workplace, childcare, climate and health issues. So it's a pretty broad list that medical societies work on. And again, a lot of these are because members have come to us and asked us to get involved and submitted resolutions on these topics. So definitely encourage you to bring ideas to your medical society in your state. These are, again, just some snapshots of ways we've gotten people involved: legislative meet and greets, coffee hours with lawmakers. And then, so that's really the state level. And then our bridge to national policy issues as a state medical society, we work with our congressional delegation pretty closely. We're in touch. So every congressional congressperson, senator, representative of the House typically has both DC policy staff, but also in-state policy staff. So we try to get to know the policy staff who work on healthcare issues, both physically located in DC and then also the people located in our state, because they're really the ones who are trying to be that bridge between what's happening in Congress and how that would impact us back in their home state and giving. And so it's really a two-way of, often sometimes they'll ask for information, like if this happens, how would that impact physicians in Vermont? Or sometimes it's us asking them, what's happening in Congress, or how can we help, or what do we need to do? So this picture here was just recently joining a press conference. That's one of our family physicians here in Vermont speaking at a press conference with our state senator Welsh on telehealth issues and trying to get Congress to continue to provide telehealth services. And then also we try to communicate on national policy through our work with the AMA. So as I mentioned, we're not a state chapter, but the link is that we send delegates to the 2 meetings a year of the AMA House of Delegates, which is how the AMA sets policy, adopts resolutions, directs their board of directors. So on the left in that picture, Kathy Schneider is a general surgeon, is our delegate. It's a little bit like Congress in that states get a number of delegates apportioned based on their size. So Vermont has one and one alternate delegate, where states like, California probably have 40, and Texas and New York, have big delegations. We, from Vermont, meet with the New England, we get all of the delegates from New England together to kind of come up with joining each other in which resolutions we want to support, be active on, oppose before each House of Delegates meeting, how to kind of divide up, especially with a small delegation, how to divide and conquer on which resolutions, which people are going to speak on. I find it fascinating to go to the AMA meetings. They're like a little mini microcosm of the country. So you get all the states, so physicians with broad views, all the specialties. So really diverse, both clinical expertise, political backgrounds, or inclinations coming together to try to set policy. The last meeting was in June, and there was a really big push pretty universally from the delegates to get the board of trustees of the AMA to be more active on some of the federal attacks on public health, healthcare funding, workforce issues. At that meeting, they had an emergency resolution on the vaccine policies coming out of DC. And I think effectively the House of Delegates sort of made the message clear to the AMA staff and board that they needed to get more in front of things, that you know, the AMA's position had been, well, they really have been pushing for years to reform Medicare payment for physicians, and which has been actually been cut for the past 5 years in a row and lagged even before that. And so that was their priority. They did not feel like they could speak very loudly on other federal issues while they were trying to get Medicare payment increased in some of the funding bills moving through Congress. And I was proud to see the AMA House of Delegates, the individual delegates from around the country, basically say, you know, you can do both, and you need to do both, and you need to be more vocal on Medicaid cuts, vaccine policy, things like that. It's also been pretty inspiring to me, as I've been watching the AMA since I came into my current role, to see how active the students, the residents, the young physician groups are, because it's really changed I think the face of the AMA. It's really pushed the AMA to get more involved. So definitely encourage students to think about AMA membership and involvement. And in fact, I have some slides here. They have an advocacy conference in DC that includes an advocacy training. And then there's also the medical student section, which is kind of the policy, the section within the AMA that drives the policy making at the November and June meetings, and a link to AMA membership information. And so that, I think, and Marvin, let me know if I left anything out of what you were hoping I would cover, or if folks have any questions or topics you want me to go more into. Happy to do that. Again, I kind of wanted to keep it more generalizable to all states, but happy to also talk more specifically about policies we work on here in Vermont too.
Jessa, that was really helpful, and I do have three things. You talked about the resolution process when a physician or a member had one, but sometimes the policy resolution may be about a federal thing, like the Vermont Medical Society. I submitted resolutions relating to federal policy. So one way for you to get involved with federal policy, our
Whoop, I think we lost your audio for a minute there. Are you still there?
How about now?
Oh, there we go. Now you're back.
Okay. Anyway, we did pass resolutions related to federal policy and Medicare privatization and all that. And so you submit that to both the AMA nationally, that this is what Vermont wanted, and you submit that to our federal delegation. Is that how this works?
You can take things several directions. Yes, you can, and I would always suggest starting by reaching out to your state medical association, because they can probably help you navigate kind of strategically where you might want to bring your resolution. Certainly resolutions can go straight they can go to the AMA. To go to the AMA, they still need to come through a state or a regional delegation. So you typically still need to start with your state medical society to get your state delegates to endorse a resolution to bring to the AMA. So an individual AMA member can't go straight to the House of Delegates with their resolution. It does have to be endorsed by a state or national medical society or group of delegates to get to the AMA. It doesn't necessarily have to be adopted as a resolution of your state medical society first, if that makes sense. You could say, I want this resolution to go right to the AMA. Can Vermont endorse it? So that's one. Or you could say, I want this to be a Vermont resolution that the Vermont Medical Society adopts as Vermont policy, And could you endorse this to then go on to the AMA for influencing AMA policy? So there's kind of both pathways. State medical societies do adopt policies on national issues, and it typically would be clarified then in the action, what action you're asking the medical society to take. It could say, the Vermont Medical Society will advocate to their congressional delegation and to the AMA or to whatever, or to, whatever, the CDC, whatever national entity they want on X issue. So you can go, I hope that helps. You can go both. You could try to sort of go directly to the AMA route with state endorsement, or you could have a state policy adopted and then try to bring it to the AMA.
One more clarification, and then we're going to go to Zach. But that's you're talking about me as a physician member. But medical students, it seems to me they have both options. They can get involved with their state medical society, potentially even putting forth a resolution, which the medical society could adopt and take that to the AMA. But the students also have an option to join the AMA directly and advocate directly.
Correct. Through the medical student section.
Option.
Yep. And I am not an expert in the AMA student resolution process. I don't know kind of what steps it needs to go through. I do know that I believe the medical student section is organized by regions but geographic regions. And so, if you join your state, you're through your school or your state, like the medical student kind of branch, then you'd be assigned to a region and kind of work within that region and could bring policies to the AMA meetings. And I think the medical student section then could potentially endorse a resolution that could go to the whole House of Delegates at the AMA meeting.
So the students have two options,
yeah,
additional options for them. Zach, go ahead.
I was interested first I want to say thank you for explaining the process of medical societies and what you can do within a medical society and what they're focused on. They kind of seemed intimidating. Maybe it's a bunch of like older physicians who don't want to listen, or I don't know. Just I get wary of interacting with institutions, but very informative talk. Makes it feel a lot more approachable. But I wanted to comment on how impressed I was with the advocacy of your specific medical society, specifically with the SHIELD law. Were you able to get that passed into like through your state legislature? Wow.
Yes, we are, Vermont is a very democratic leaning state. And we are not the only state, and I believe the number is around 15 states have pretty protective SHIELD laws that are probably quite similar to Vermont's. Most of them passed sort of a year or two ago, a couple of years ago, the first time around. And so we worked as a medical society very closely with some legislators, with Planned Parenthood, with the ACLU of Vermont, sort of other organizations, and actually learned a lot. Massachusetts had passed one sort of before we did, because they're on a year-round legislative cycle where we have a citizen legislature in Vermont, as a lot of smaller states do, where they're not, they only meet part of the year. They have other jobs. They're not really experts in their area of legislating. And so, we could learn from what Massachusetts had passed and also talk with some other, national experts. We had a law school professor from Massachusetts who gave us some input as well. So, but we were pretty instrumental in that. I will say, the voice of physicians really mattered on that bill, as with all the bills we work on, especially in a state where legislators don't have staff, are not healthcare professionals. They really rely on that testimony from practicing experts in the field to say, this is, what I'm seeing in my practice. We had a pediatrician talk about the evidence on gender affirming care. We had several OBs and OB residents talking about performing abortions and why, for example, they didn't want their address publicized, or why, like in our latest changes to the bill, why we want the names of the prescriber to be able to be taken off the prescription label in case of patients crossing state lines. with that in their possession and what could happen if it gets found. And so to translate sort of the abstract concepts into here is how this impacts my practice, my ability to create a relationship with my patients, is really critical. And in our experience, at least in Vermont, and I don't think too different elsewhere, they love hearing from medical students. I know being engaged with the medical society can maybe feel a little intimidating. Being engaged with the legislature can as well, but that is something a state medical society can really help break that down and not feel so intimidating and bring you to the Capitol, give you a tour, introduce you to lawmakers, prep you for testimony, give you talking points. And on things like, say, loan repayment, or like how can we, every state wants medical students to stay in their own state. Like, how can we get you to stay here? What would attract you to practice here? What should we be doing differently? They really do want to hear from you and value your voice. So I do encourage you to partner with medical societies to get more engaged. And to your point about sort of the feeling like maybe they're made up of the older generation. I medical societies are also trying really hard to change that. At least the ones I work with the most closely, they love having medical students, residents, younger physicians engaged, helping inform their policies. You bring a different energy, a different perspective to both the medical society and again to advocacy efforts to say, well, here, I don't even want to practice in this state unless X, Y, and Z changes, or here's what I love about practicing here, and what would make me stay. So it's really important.
And then I guess a follow-up question would be, would you say, I know you said that there's several medical societies that are maybe as democratic or progressive as Vermont. Would you say that maybe that's not typical, like California?
That's
I
a
guess
good
I'll ask
question.
about
Yeah,
California specifically.
it definitely, I think medical societies really try to reflect their membership, and physicians' politics are probably about as broad as the general public's. So, I wouldn't be, I think most medical societies, and they have to bridge their members' perspectives with the political environment in which they find themselves and which their state is in. So I've had a lot of conversations, say, with the CEOs in Idaho and Wyoming, and they are really challenged. I mean, the challenges to things that really almost all, no, I can't say all, most physicians really support, vaccines, safe maternal care. Like there's a lot that physicians actually do agree on, I would say actually almost regardless of politics. But their legislatures are so extreme right now that they have to be really careful how and what they can advocate on. We are a little, we are a little insulated from that here in Vermont. The other, strong democratically leaning states are pretty much the same. It's the same states who are challenging a lot of the federal, executive orders through their attorneys general. So, Massachusetts, Vermont, New York, California. It's not a shocking list. And so I would think those medical societies also, reflect the state politics a bit, but it's not, I don't want to, I think even in states where the politics are tougher, the medical societies maybe can't be as out front or vocal on certain issues, but still really try to have that core of believing in science, believing in evidence, believing in taking care of patients. And so it's kind of the strategy of which issues do they pick, what can they be successful on, again, hearing from my counterparts in other states where they don't have shield laws and abortion is illegal or largely illegal, they're really trying to work on at least more reasonable, health exceptions. So when a woman's having a miscarriage, what can be done in the emergency department? So they're trying to do what they can within the constraints that they find them, they are in politically.
If there's no other student has a question, I wanted to point out that when I submitted the resolution about Medicare privatization, what I found was that I didn't feel that I met opposition, as this was a territory that these physicians had not focused on. They're trying to get through every day in their practice. A lot of them are working well into the evening in primary care just to deliver direct patient care. And I think Jessa had, so I mentioned specific programs, and rather than do that and be forced to sort of provide a whole lot of policy education to every member of the state medical society, Jessa looked at this and just suggested, well, why don't you come up with what the principles are? You don't want doctors to lose money if their patient needs a heart transplant. Basic things. You shouldn't be losing money if you're treating patients who are very sick. So we kind of boiled it down to basic philosophical principles of what we would want in, in federal policy. And that was much easier to work with. And I think, so if your specific proposal is when you're interacting with the State Medical Society or AMA, if they're kind of falling into that category, you can look at what are you really saying here? What is it about the program that one would object to? And I think you're going to find a lot of commonality, as Jessa was able to do when she helped me with that.
Yeah, I think that's a great suggestion for any resolution, is to try to make it, you need to make it specific enough that it's different or new from other resolutions, but also generalizable enough that it doesn't become outdated in a year, or maybe could you not refer to just one policy issue, but more of a philosophy or a topic that you're wanting to talk about, a universal principle of practicing medicine that you want to address. So yeah, and I'm happy for any of you. I know none of you are in Vermont, but if you ever want to talk about strategies for advocacy on an issue, or connecting you with your a state or national medical society you want to work with, I'm happy to do that. Marvin has my contact information, so feel free to reach out, and I can connect you further, and either in topic areas or geographic areas to what you're interested in working on.
Yeah, I want to make one more statement before you go. There's one additional thing that I think I didn't hear, but it's something you help everybody with, which is, yes, if a physician has an idea or a resolution, you'll help concretize that and help to get it to the membership, to the board, et cetera. But you do something else, which is probably universal in all the states, and that is you have your ear to the legislature, which physicians do not have the time to do. And so there's a two-way street. You're bringing stuff to the membership to tell them this people in the legislature are talking about such and such. And I think looks to me to be of interest to physicians. So, you initiate discussions when the legislator is moving into some new area, and that's really valuable. And in that regard, and thank you for doing that, and your alerts are really helpful too. But anyway, and so one of those issues you told me, when I invited you to tomorrow's panel on corporate practice of medicine, you told me that they're already working on that, and I hadn't known that. So I think there's information flow in both directions. And so anyway, I just want to thank you for all this work and for taking the time to join us.
Yeah,
and I hope you'll come
absolutely.
back.
And that's definitely one of the, that's one of the places not as, in students, you may not have medical society dues, which is great. But as a practicing physician, when you're paying the dues, a lot of that's going to the salary of lobbyists, which can be considered a bad word, but it's also, there's no way that a medical student or practicing physician can be in the legislature all day listening to things. And in many legislatures, even more than Vermont, things happen at midnight or behind closed doors, or, when they're adjourned. And so if you don't have, unfortunately, the way politics work in the United States, if you don't have somebody who has the time and is paid for their time to follow all of that, it can be very hard to know sort of when and how to engage effectively. So we definitely need you to be the voice of a lot of the issues, but then we can be the ears to the ground, knowing when things are happening and when people need to plug in.
Yeah, thank you so much. Any more questions from the students, interns? If not, I guess we can adjourn for the medical interns. Those of you who have time, I hope to come at 7 to hear Shivani. And Jess, I hope we'll see you tomorrow if you have time to join us for that discussion. That would be great.
Great. So I look forward to it.
Corporate
Sounds good. Thanks for
practice.
having me. Nice to meet you all. Have a good afternoon.
Thanks
You
so
too.
much.
Thank